Hi, welcome to The Public's Health, the show that puts the public, that's you, back into the public health. I'm Tony Iton. I'm the Alameda County Director of Public Health, and this is a product of our health department. Today we've got a wonderful panel of guests who are focusing on this theme of preparedness and vulnerable populations. We're going to start with Rachel Murray, a mechanical engineer and a child safety consultant. Welcome, Rachel.
Thank you.
Tell me a little bit about how big a problem is child safety in the home?
Well, it's remarkably big. While many parents don't find the time to childproof, it's useful for them to know that each year 1 in 4 children will end up in the emergency department with a preventable injury that took place at home. Furthermore, between the ages of 1 and 4 years, the most likely cause of death to children will be an injury that took place at a home.
Wow.
So it is really imperative that parents invest the time and the money to make their home environment work better for their child.
Do you think parents know this?
Well, in a recent study by Home Safety Council, they found that a third of the parents didn't know where to begin. A quarter of the parents didn't have the time to childproof their homes, and the lists went on for the reasons that they didn't childproof. Fewer than half the houses out there with kids are childproofed. And what we've come to know is that many of the same injuries keep taking place, and there are measures available to prevent those injuries. So we've begun to look at it a little differently. Pediatricians will instruct parents at one of the well baby visits that it's important to childproof their homes and that their children must always ride in car seats. The problem arises, though, when parents get to the store and they are overwhelmed by the variety of products available. Many of the products that are widely available at the large stores are ineffective and don't work well. If the parent has taken the time to go to the store and get the product and it didn't work, they're very unlikely to go back a second time. So they've tried to follow the pediatrician's recommendations, but they're lost. And so I started a business 12 years ago, childproofing homes, and there are a number of these businesses out there, and they tend to be very useful for the middle and upper income families. They are often unaffordable, however, for the low income families. So what has emerged is a health disparity. We find that injuries are 4 times as frequent in children in low income families.
Wow, that's really quite a startling statistic. We've got some tape of some of the steps that families can take to childproof their home. Why don't we take a look at that?
Children are often intrigued by the small objects that we have lying about our house that can pose a significant choking hazard to them. At sharp corners, with early sitters or proficient runners even, they run the risk of cutting themselves if they fall against these. So we recommend cushioning them as such. At coffee tables that have sharp edges and corners all the way around, it can be a good idea to use a cushion that encloses the entire perimeter of the table. And even at the corners that are down low for the early sitters. Televisions are among the first objects to fall over in an earthquake because so much of their weight is in the front. I recommend that you give your television a seat belt. At wall diffusers for furnaces or floor grates that get very hot to the touch, it may be necessary to put an enclosure around it. All bookshelves and dressers should be braced for protection in an earthquake or from a climbing child. If you notice, a bookshelf will appear to a child as a ladder. The toilet poses a drowning hazard to young toddlers, so we recommend putting a latch on it. You want to be sure that your hot water temperature does not exceed 120 degrees Fahrenheit. You can use a meat thermometer to measure it. At hot water heaters, to be sure that the water temperature delivered isn't any greater than 120 degrees Fahrenheit, it's often necessary to turn the dial down to warm, but you'll need to check to be sure. At on-demand hot water heaters, they're often limited to 120 degrees, but you'll want to check that as well. It's important to limit how far each window can open to only 3 inches. You can do this by putting in a cable. To prevent falls through windows that slide open, either vertically or horizontally, you can put something as simple as a window wedge. The cords at window blinds pose a strangulation threat. It's advisable to put up a cleat around which the cord can be wrapped. If you will have a fire present while the child is around, it's important to have a barrier in front of the fireplace to keep them a safe distance away. If the child is able to open the oven door and perhaps stand on it, they might be able to tip the whole stove onto themselves. It can also help to have a latch on the oven door. At the stove, some people choose to put on covers over the knobs so the children aren't able to turn on the burners. Others simply choose to slide the knob off and only put it on when they need to adjust the temperature. While cooking, it's essential that you start using the burners on the back and always face the handles toward the back. If a pot is out here and a child can reach it, they might not only burn their hand on the pot, but empty the contents that are scaldingly hot onto themselves. Many homes have balconies or banister railings that are too widely spaced for kids. If the opening is more than 3 inches wide, a child can become trapped in it or fall all the way through. Very often, it's necessary to cover these openings with a mesh. It's important for parents to explore their yards and check their own houseplants to see which are toxic if ingested. This is oleander, which is highly toxic. Another common plant found in the yard is the azalea, which is highly toxic.
Wow, that was chock full of information. I mean, very informative. Anything that was missed in that video that you'd like to discuss?
Yes, I think you can see why parents are overwhelmed when their children begin to move. The largest percentage of injuries that kids sustain involve falls. More than a third of the visits to the emergency department. So it's important to protect corners, but also to install gates at the top of stairs. They must be screwed in if they're positioned at the top of a staircase, and there also needs to be another gate at the bottom of the stairs. Once the child is climbing age, it's imperative that all the windows that previously weren't within their reach then become child-proofed, because otherwise they do frequently fall out. Almost every day in this country, a child falls through a window. Also, the second most common injury is from poisonings. So one common strategy is to place the poisons up out of the reach. These include lotions, cosmetics, cleaning supplies, vitamins, and medicines. But also, people need to provide cabinet latches. Now, this is one of the more difficult products to install and will render a mild-mannered father into a cursing sailor, but it needs to happen. And then also, you'll need to look at keeping children from outlets. Many parents, when I go into the home, have inserts in a lot of their outlets. You want to be careful that these inserts aren't so small that they pose a choking hazard. Many kids are drawn to an outlet with an insert in it. I recommend instead a sliding cover that automatically closes and makes the outlet inaccessible to them, even if they pull out the plug. And parents don't have to remember to put an insert back in.
Go ahead.
Next, we worry about cribs. We want to be sure that there aren't too many any bedding items in the crib, including stuffed animals. We don't want the cribs near the window. We don't want them to have access to the blinds.
That's a lot to remember. No wonder people need a consultant. Let me ask you this. For a low-income family, of which we have many in Alameda County, who have children and are legitimately concerned about all of these risks in the home, and some of them may not have control over their home. They may be renters, they may be staying with people whose homes they don't control. How do they get access to this kind of information, these kinds of services?
Very often they'll try to call me on the phone, and I can talk them through the product selection. But and some public health departments do have some products available, but very few, and a very limited supply. So it can be frustrating. It would be nice if the childproofing industry progressed as the car seat industry has, where if a low-income family visits a car seat clinic, they may be provided with a low-cost car seat. So I hope that that will be something that comes in the future. As we know, 90% of car seats put in by parents end up put in improperly. Now, Safe Kids Worldwide has been training car seat technicians for many years so that they can teach parents how to correctly install the car seat and fit it to their child and fit it in their car. The same kind of progress needs to take place in home safety.
Well, that's very informative, Rachel. Let me ask you one last thing. We're on a preparedness theme here today. Any special caveats that parents of small children should be aware of in the event of a disaster?
Yes. When considering what to store, include in your disaster supplies, you'll want to add things like baby formula and baby foods, and enough to last up to a week, and enough water for your baby. We also recommend that you have an ample supply of disposable diapers, and in the current size.
Oh, very good advice. Thank you very much. Now, from young children to the other end of the spectrum, we're joined by Colleen Campbell, the coordinator of the Alameda County Senior Injury Prevention Program. Welcome, Colleen.
Thank you, Tony.
We've heard a little bit about the data on injuries to children, very frightening sounding stuff. What about seniors? How big a problem is this with seniors?
It's a huge problem. In the case of seniors, in Alameda County, seniors represent about 10% of the population, but they account for 43% of the hospitalizations due to unintentional injuries. So it's a huge number. And 75% of those hospitalizations are from falls. Falls is the leading cause of injuries to older adults. The good news is that there are several things we can do to lower the risk of falling as we age. There are things we do on an everyday basis that put us at risk, and generally those are habits. We get in a habit of hurrying when we walk, and that puts us at risk. We get in a habit of carrying things in front of us, so now we are walking and can't see where we're putting our feet, so that puts us at risk. Even the way we get dressed in the morning. Do you stand up and put your pants on in the morning?
I couldn't tell you. I don't know.
Are you still asleep when you're dressing in the morning?
Pretty much.
That would raise your risk of falling. And we've had people who have fallen because they do stand up and put their pants on. And now you're standing on one leg struggling to get your clothes on. Whereas if you sit down in a chair and put both legs in your pants, you're not taking the risk of falling doing that. So it's simple things that we do on an everyday basis that we have to look at in terms of our behaviors that can reduce our risk of falling.
So if you're a consultant now to a couple of seniors, what kinds of things do you look for that are high risk things that you can help change to reduce their risk of fall?
Well, in addition to behaviors, we look at physical activity. One of the best ways you can lower your risk of falling is to be physically fit. And that doesn't mean pumping iron or running marathons. It just means keeping your body moving and keeping everything flexible and in good working order. Also, even nutrition, how we eat, keeping everything in good working order by the way we feed our bodies. As we get older, it's more important to take care of us, just like we would take care of a vintage car. We want to take care of our bodies so that it runs well as long as possible. Another factor, and a big one, is medication management. In California in 2004, there were 3,000 people over the age of 65 admitted to the hospital for medication mismanagement.
Wow.
So you have to figure if there were that many that were sick enough to be admitted to the hospital, there are many thousands more out there who aren't quite that sick, who are mismanaging their medications. Mismanaging your medications can cause lightheadedness, dizziness, headaches, all kinds of things that each one of those raises your risk of falling a little bit.
Wow. So nutrition, physical activity, and making sure that those medications are appropriately managed and they don't have the interactions.
Exactly. So What we'd like to suggest to everybody is to keep a list of all the medications you take, including herbal remedies and over-the-counter medications, so that you have a pharmacist someplace who's reviewed all of those and ensures you that everything that you're taking together is safe to take together. And then every time you get a new prescription, you take that list in and have them look at it to make sure your new prescription is going to be safe.
Very good advice. Now, on preparedness, what do seniors need to know, that one caveat that you tell seniors in an earthquake or in a flood or in a weather emergency? What do they need to know?
Well, basically, one caveat would be if you have special needs, you need to make special plans. No one is going to be there. We can't count on anyone being there for the first 3 days. If you need help evacuating, if you need help getting through your daily chores, this is something you need to take into consideration when you're planning for a disaster or any kind of emergency.
Very good advice, and extremely well said. We're now going to move to emergencies, and we've got some footage of what the man on this street thinks about when they think about disasters.
I just wanted to ask you a few questions about disaster preparedness.
Sure.
So I'm wondering, how many days worth of food and water do you have stored in your home currently?
Probably about a week's worth.
Well, food would probably last 3 or 4 days,
Okay.
or maybe a week. You know, we
Okay.
have a lot of cereal and so on. Water, though, we only have what's in the, I think we just have a 5 or 10 gallon
Okay.
jug of water.
Maybe like a week and a half.
Probably about 3.
3
'Cause I
days?
eat most of my meals at work.
We have a pretty big pantry downstairs just for that purpose. So I would say probably a month.
I'd say maybe about a week's worth of food, water, probably about maybe 3 days.
If it wasn't on a grocery day, I think about 2 weeks.
I would assume about a week since I have a largish family of, 5. But if it were to come to that, I'd probably have to kill them and eat them, so.
Wow.
Then I'd have a lot of food.
And if you have flashlights in your home, where are they located?
Those we do have by the bed.
I have one in my room, and I think my parents have one in their room, and there's one in the living room too.
They're located in my toolbox, in my nightstand, in a kitchen drawer, scattered all over the house, really.
One's located in the everyone closet. And I don't know. I think there's just one.
One are in my room, and one is outside in the living room, kind of .
I would say I don't have one.
I think I have 2, but I don't know where they are, and one of them is broken, so I only technically have 1.
One in the living room plugged into the wall. It's one of those you just pull out and use. And then another regular flashlight stored in the office.
What are you going to do when the lights go out?
I guess get a flashlight, so I'm ready.
All right. If disaster were to strike the Bay Area, do you think that Bay Area residents could have an experience similar to the Katrina survivors in New Orleans?
Well, given what happened in New Orleans, I would be afraid we might, especially if there was a massive earthquake.
I'd say overall it wouldn't be quite as bad. I mean, and also we'd have, I think the city is better prepared to handle that. The police and fire department, I think, are better prepared.
I think it might be worse,
Really?
considering we're close to the ocean.
No, I just think it depends. Depends what happened. If it's a small one, I don't think it will be like it. But I think if it's a really big one, I think it's gonna be as like it.
For some reason, I don't think so.
Yeah, I think so.
The Bay Area is pretty expansive. There's lots of other metropolitan areas that I think could lend assistance a lot faster, I think.
And we have crazy people.
I think it would be just as bad or worse.
I guess it potentially could be.
I don't think we suffer as much.
All
At
right.
least I hope not.
Do you think there could be more done in terms of disaster preparedness to protect the community?
I think everywhere, yes.
Everywhere. Things like?
Well, education for one.
I think needs to be increased awareness.
Each city needs to have a good disaster preparedness plan.
And I think we need a better disaster preparedness mascot because we don't have a disaster preparedness mascot.
People would just be out of their minds. I know I'll be out of my mind.
Really?
Give people warning and like tell them like this and this will happen.
You know, having batteries and Ziploc bags and flashlights.
I would think the funding of emergency services would be one of the biggest things.
We could do it as a government. I think it'd be awesome.
Wow. All right.
What kind of mascot?
Yeah. Ideas.
Oh, something, a panda.
And there you have some ideas from Alameda County residents. And we're now joined by an expert in our county, Anna Marie Jones, from CARD, or Collaborating Agencies Responding to Disasters. Welcome, Anna Marie.
Thank you for having me.
What did you think of what you just saw?
Well, I saw a lot of concern and wishful thinking, which is pretty much true everywhere we go. There are many people who are very concerned about what's going to happen and how little they really know, and they know they're not prepared. And then we have also the hopeful and the wishful thinking that, oh, it's not going to be that bad and people are going to respond and it's all going to work out. So we always have the extremes.
So the concern, though, would seem to be fertile ground for agencies such as yourself stepping into the void, providing useful information to people. Have you found that that is creates an easier and more receptive audience for you?
Most of the time it does. Unfortunately, so many of the messages we hear about the disasters and threats, they are so oppressive, fear-based, and disasters we can't control, where people don't feel that they could make the difference. Terrorism and pandemic flu and things that just seem so overwhelming that many people use it as an opportunity really to tune out of the message and defer to wishful thinking.
Well, that's a very interesting insight. So how do you make this real for people? How do you make people feel like they can do something about this?
Well, at CARD, since our focus is community-based organizations, faith-based organizations, we thought it was inappropriate actually to go to them with fear and threat-based messages, to go into poor communities that are struggling day to day and tell them about the terrible things that are way worse than what they had ever imagined. It really didn't work. So we make it real by making it very positive. And we've taken the attitude that we're not preparing a community for disasters, we're actually preparing them to prosper. Building their resilience, building their capacity to be critical thinkers, knowing how to communicate with each other, knowing how to mobilize their assets, and by making it positive and immediately relevant, it means that more people are willing to engage and really follow the steps that we are sharing with them.
Wow, fascinating. So you're really talking about building community capacity by working with those agencies that work with vulnerable populations. Is that basically what you do?
Absolutely. Rather than trying to reach every individual senior or every individual child, you can reach and track each agency that serves seniors, each agency that would serve a child. And by helping those agencies to have a plan, to understand the importance of communication, to make them the educational force for their community, it builds, one, a bond between that person and the agency. It builds that agency's capacity to work with government and traditional response, and nonprofits and service providers are a critical part of our economic well-being. So in terms of long-term recovery, in terms of getting culturally appropriate messages out there in the world, nonprofits are absolutely critical to that entire continuum of service.
Let me ask you a slightly difficult question. In Katrina, we know what happened. What would have been different had CARD been involved in those neighborhoods in Katrina working with agencies that serve those populations?
Well, for us, the most obvious thing is that there would have been some really basic levels of training and skills. For example, because very few people actually plan. I mean, it's easy to say, have a plan, but most people don't plan. We actually don't put a lot of emphasis on that word. We talk about critical thinking skills, so helping people to think through the circumstance, to know the basic things they could have done to communicate. For example, even after all of the horrible things happened, when people were stranded, if people had known to scavenge for, oh, it could have been lipstick or paint or mud even, if they had known to take those items and write their names in the largest possible letters across their chests and their backs, it would have done three things immediately. Number one, it would have humanized people. I wouldn't be helpless, hopeless, faceless. I'd be Anna Marie. That would make a big difference just at the social level. Number two, imagine the relief for your family the minute they saw that helicopter photo or that satellite image and they saw your name. It would be that immediate confirmation of life. And number three, even if I didn't survive, I know my family would want my body back. They wouldn't want to wait 10 months. And we're going to spend millions of dollars in DNA and dental record identification just because people didn't have any form of ID on them. So simple, simple things that would have made an exponential difference is what we could have brought to the table.
Excellent. Now, very quickly, what are the priorities for CARD now working in Alameda County? What are the things that you have set up for this year that are the key things on your agenda?
Absolutely building our capacity to reach more agencies. We have several partners across the Bay Area, actually, and they want to learn our particular curriculum. We developed a special curriculum for community-based organizations, something that did not exist before. So now we are training other agencies so that they can successfully deliver it across the region. And inside Alameda County, now that more funders are stepping forward to really acknowledge that nonprofits have a key role, we are looking at how do we target particular vulnerable communities. Every church in a particular neighborhood, every senior facility in a particular region, and elevate the level of preparedness in each of those entities rather than random acts of preparedness and senseless acts of planning. You know, here's a brochure, here's a binder. We want to have it to be a graduated, absolute, we are on a path together to prosperity.
Wow, excellent. This has been such a wonderful show. We've been from the very young to the older to our most vulnerable populations, and we hope that our communities have gained some awareness of how we have wonderful resources in this county to be able to address many of these issues. And I liked your point, and I hope you would repeat it again. Rather than coming at people with a fear-based message,
we believe we should prepare our communities to prosper. Take the fear, take the threat out of it, and make this about community building and the active engagement of our entire society.
Thank you very much. And there you have it.